Well, I am thrilled to be here with you all to celebrate the day, World Patient Safety Day. I am a director of the Better Birth program at Ariadne Labs and have been fortunate to work for many years in Uttar Pradesh with several colleagues at the Community Empowerment Lab, as well as colleagues at the Ministry of Health and Family Welfare and among others. So I'm thrilled to be able to introduce our distinguished panelists, and I think we have a slide set up, and I just want to make sure that that's ready to go. So as mentioned by Dr. Lallu and others, we have a series of presentations that's going to take place over the next hour, and we hope to share with you learnings around the WHO Safe Childbirth Checklist implementation and the efforts that have been done globally, particularly in India, but also in the region and with colleagues in Sudan. So I'm just providing a brief bio for each person so we can get to the panel itself. So Dr. Hema Divakar is a medical director at Divakar Specialty Hospital in Bangalore, India. I'm going to have a conversation and you can hear their experiences with implementation. Some of these partners we've worked with for quite some time to understand what are the implementation approaches, strategies, and challenges. So Dr. Hema, you have been leading, along with colleagues at FIGO and elsewhere, the Minyata initiative, which is focused on improving childbirth quality in the private sector in India. And the Safe Childbirth Checklist is used as part of Minyata. And I wonder, how do you see the innovation of this work and your work with Minyata emerging through the private sector and how we can use the Safe Childbirth Checklist in the private sector? I'll turn it to you, Dr. Hema.
Thank you, Katherine. Namaste, everyone. We need many, many such champions in this vast, complex, and a diverse country to do our bit. So when we had the opportunity with the support from MSD for Mothers to take a peep into the private sector and see whether they're adhering to the clinical standards and especially about the respectful maternity care, which you by default expect in the private paying patients who go to these segments, we thought it was a wonderful opportunity for our organization way back in 2013 when I was leading as a president. But then we were also a little skeptical. How will it be if a professional organization takes a peep into the private segment and try to intrude into what kind of practices they do? But we also thought, well, it may not be so difficult. They may be already up to the mark. The baseline scores may be fantastic. So we have just a little bit of work to do. But no, it really, really opened our eyes into, as Rose said, the knowing and doing gap that was very, very glaring. So what we embarked was something very, very simple. We said, here is the FOXI leadership, which is defining just 16 clinical standards in alignment with the WHO Safe Birth Checklist, as you have alluded to, and also the FOXI guidelines itself. And our vision was something simple, something doable, something feasible, something practical, pragmatic, just let's do it. That's the spirit with which we embarked on this. And we did not ask for any change in any of the smaller or bigger private hospitals or little mama and papa shops, as you call it, in the nooks and corners and interiors of our country, where we took this Manyata project into whoever was existing there. The same infrastructure, the same staff. And we were amazed to see the pre-training and the post-skill transfer change in adhering to the clinical practices, in the data documentation, in the whole change of the work culture, in which they were so confident and competent and so responsible to believe and take the pride in the fact that they too are a very important component in the chain of delivering healthcare. So that, I think, made a lot of difference. Then the challenge was how to reach the interiors, how can we get our leaders and members for on-site training, etc. And then, as God would have loved it, COVID came to our rescue for transforming our entire skill transfer program on the digital platform. And sitting in the city of Bengaluru, we've reached 14 states, pan-India on this initiative. The small challenge was of the language, because each of the teams of staff nurses have to, so we have a Tamil batch for Tamil Nadu, a Kannada batch for Karnataka, a Marathi batch for Maharashtra, and a Hindi batch for UP, and so on and so forth. So that the understanding is perfect, and it gave a lot of opportunity to do a low cost but far reaching and percolating initiative. And I'm happy to say that more and more of the private segment have recognized the importance and value of this simple but very impactful, effective training. And there is absolutely no looking back from our side. We have done about 1,800 centers already, assessed and accredited. But the first landmark which we want to reach is at least 5,000. And the dream is to scale it up to 50,000 at the minimum. So please do wish us good luck.
Absolutely, we wish you good luck. And I think it's wonderful to hear about the strategies that you've been using, about focusing on being able to create change, that you don't have to have everything working all the time, but it's really about making steps towards improving maternal and newborn safety. I think one of the things we've heard is this idea that it can work in a variety of settings and environments. And I think that's one of my key messages. It doesn't have to be a state-of-the-art hospital, and it doesn't have to be a small maternity home. The Safe Childbirth Checklist can work in any setting because the adaptability is key. There's a question about companionship and how is that included on the checklist, and whether or not a companion in the labor and delivery room could help encourage the use of the checklist or following the checklist. Dr. Hema?
Yeah. So, Katherine, as I said, the country is like very varied, and the cultural context, about who can be with the women during labor and private movements, etc. It's very, very different in different parts of the country. Having said that, once we adopted the Manyata checklist, which also has one of the standards, standard number 5, as respectful maternity care, privacy, confidentiality, the presence of a birth companion, all of those things were collaged into one. And we recognize that it is a low-hanging fruit. It's just a change in behavior. It's so simple to do, and you can't make any excuses that you're short of this or the other. And it's absolutely the weightage of the score for accreditation is huge on that particular standard. I just remember one anecdotal incident in Tamil Nadu when the whole team of Foxy went to do some program labor initiatives. There was way back, 12, 15 years back, there was one companion as per the Tamil Nadu government rules with every laboring patient. And the moment we went in, we said, oh, this labor room is too crowded. Why so many people? And then, the head nurse there said, all of you get out. The guests have come from various parts, and everybody were made to move out. And then that, as how our luck would have it, came the government officer there and said, who has driven them out? That kind. So way back there, my thoughts went to the process, and we really scientifically also, it is so very meaningful to have a companion. And ever since that time, we have been making sure that wherever possible, it is good to change the cultural context even, and to see to it that these important doable initiatives are the norm or the expected standards of practice. And that's how we have moved ahead, incorporating these soft areas beyond the hardcore technicalities and adherence to clinical protocols that we expect.
Wonderful. And I just want to take a moment to say thank you so much to our expert panelists for joining in this wonderful discussion from around the world. Literally all time zones are covered right now. And I want to highlight that, of course, this dedication to World Patient Safety Day and your dedication to achieving safe and respectful childbirth and safe and maternal and newborn care is inspiring to me and the work that I do. But I believe that this panel has been helpful in identifying that it's not always an easy road, but it is definitely progress can be made. Again, I want to thank the leadership for inviting me and allowing me to moderate this panel. It's been really a wonderful experience. Namaste.
Thank you. Namaste.
Thank you so much, Dr. Katherine. Indeed, a wonderful session. It's overwhelming to hear from so many experts across the globe and their experiences, the challenges. And from CAHO, as Dr. Anu said, we are the consortium of accredited healthcare organizations in India. We have excellent stakeholder base, quality professionals, doctors, nurses, administrators, who are very passionate about quality and patient safety. So we are sold to the idea of promoting this safe child checklist. And this year we are going to be taking this as our agenda to motivate more and more hospitals join the journey, and we are very sure that we'll be able to promote this in a big way in this country. And as Dr. Anu said, our partnership is growing, and we'll be able to certainly have training sessions conducted across the country. We are really committed to what we are talking about today, and next year let's all meet together and see the success, and where after 365 days, where have we gone? So that will be a good thing to look forward to. And thank you for sparing your time. Wonderful session. And thank you for all the panelists for sparing your time and your experiences.